My son was called Jack. I gave birth to him in July 7th, and he was fine during birth. But at some point he started crying, and when I took him to the doctor, he had a problem with his chest. But I didn't suspect anything serious. And after 2 months, that is September 7th, he died at exactly 2 months.
Jack was HIV positive. He now rests in this children's cemetery in Nairobi, Kenya's capital city. Most of these children died of AIDS. These young victims only lived a few months or a few years at best, a life that many have started not far from here, in Kibera. More than 1 million people in houses made of corrugated iron and mud. Kibera is the largest slum in Eastern Africa. As in many developing countries, AIDS takes a heavy toll on communities. Children are no exception to this. 120,000 Kenyan children currently live with HIV/AIDS. About 18,000 of them are in urgent need of antiretroviral treatment that would extend and improve the quality of their lives. The fact that so many children die of AIDS is due to the lack of adapted treatments and also to the impossibility of testing children early enough. This child, whose mother is HIV positive, is now old enough to be tested. Before the age of 1.5, it would have been useless. The routine test used is based on detecting antibodies to the virus. But all babies born to women with HIV carry their mother's antibodies until the age of 18 months. It is therefore impossible to tell whether the antibodies detected are the child's or the mother's. There is currently no simple and affordable diagnostic tool to detect HIV in young children. After a 15-minute wait, this woman learns the result of the test. Her daughter is HIV positive.
She has felt so shocked to learn the kid is positive, and it's very unfortunate, she says. It's very unfortunate for her kid. And she's asking me what is going to happen now.
This child is lucky enough to be put under treatment. Unfortunately, around half of all children with HIV/AIDS will never live to see their second birthday. From now on, the child will be monitored in this Médecins Sans Frontières clinic. It was set up in 1997 in the heart of Kibera in collaboration with the Kenyan Ministry of Health. There are very few children with AIDS in rich countries, thanks to effective measures to prevent mother-to-child transmission. But in developing countries, it is difficult to apply the same elementary standards in order to prevent babies from becoming infected.
In the developing world, most mothers still deliver at home, although there is a prevention of mother-to-child transmission program. It's not so effective. Mothers are given neferapine to take before delivery, but they deliver at home. We don't know if they really take those drugs effectively. There's not the option for most people to have an elective cesarean section, and there's often not the option to give formula milk compared to breast milk.
As a result, 95% of HIV-positive children are infected during pregnancy, at birth, or during breastfeeding. The lack of adapted treatments for infected children is another real challenge for medical staff. This pharmacist, for example, is explaining to a mother how to transform a drug for adults into a drug for her child. If properly dosed, the treatment is as efficient as the one offered to adults, but having to tinker with adult formulations adds an extra burden on caregivers and medical staff.
After folding the drugs, then she uses a bottle. Then she'll have to crush it to make sure it is in a powder form.
Breaking up tablets or crushing them into powder is hazardous. A slight overdose can be toxic for these young patients, whereas underdosing can lead to development of resistance, which will make treatment inefficient. Joanna is 5. Since she tested positive 3 years ago, she has been on ARVs. She has regained weight and leads an almost normal life.
16.3.
Catherine, Joanna's mother, regularly brings the girl to the clinic for checkups. But because children grow up and gain weight, the treatment dose needs to be constantly adjusted. This requires a lot more time and energy from the medical staff. For parents and caregivers, it is also a huge challenge. We visited Catherine's house. She lives in a tiny shack with her own 4 children and 2 others left behind by her brother who died of AIDS. In these conditions, it's not easy to store the drugs and to administer them properly. Catherine lives in the constant fear of her daughter not getting her doses regularly.
She always reminds me that, Mom, please give me my medicines. If I miss to take them, I might die. But me as a mother, when I'm not around, I can leave her with her brother, and the brother can get a lot of experience of breaking it into two pieces. One can be small and one can be big.
An ill-adapted treatment that does not allow for mistakes. Because children in rich countries rarely require these treatments, and African children do not constitute a profitable market, no easy-to-use and affordable pediatric formulations have been developed to date. The same goes for cheap and simple diagnostic tools.
The biggest problem at the moment is that the children with HIV who are suffering and dying, the vast majority are in the developing world. And the people who can change the situation for these children, these are the international governments, international agencies, the pharmaceutical companies, and they are all based in the developed, rich countries. I'm sure if it was their children that were suffering, the present situation would be quite different. So we need a greater commitment and a bigger response, particularly from the pharmaceutical companies, so that they can design pediatric drug formulations that can be used in a resource-poor setting.
Of the 2.5 million children with HIV/AIDS worldwide, 9 out of 10 are African. Only a few thousand of them have access to treatment. Branda, for instance, grew up without her parents, who died of AIDS. She's 10 years old, an unusually high age among HIV-positive children. She knows exactly how precious access to treatment is.
They started giving me that medicine, and then now my body is strong.
Branda also understands that she needs to take her medicines regularly.
I take this medicine the time which the doctor have told me. If I won't take that time, I won't.
Without treatment, half of all children with HIV/AIDS will die before their second birthday. We desperately need diagnostic tests that work for babies and pills that kids can swallow. While you were watching this, 8 children around the world died of AIDS.